Well, here we are with Dr. Riopelle again. Hi, Dr. Riopelle.
Hi, Helmut. How are you today?
Good. Dr. Riopelle, you got yourself an oxygen chamber, hyperbaric oxygen chamber to treat wounds, I guess. Tell us a little bit about it. Shed some light on it, why you got it, and what do you think is the benefit for your patients in that with that machine?
Well, we do a great number of cosmetic dermatology procedures, and patients are always concerned with getting the best possible results and with healing as rapidly as possible. And so we obtained the hyperbaric oxygen chamber to aid our patients in healing more rapidly and healing with the best possible outcome. The hyperbaric chamber works by increasing the availability of oxygen at the site you've treated, so that if one is getting more oxygen to the site, a wound will heal more quickly, for example, or heal in a better way, or if it's having any trouble healing along the way at all, it will improve the ability of the wound to heal.
I got it. Because, you know, the hyperbaric chamber, by getting more oxygen in it, in terms of like wound healing, I guess it is approved by the FDA, but not for many other things which it is actually used for by many other people and groups, it's used for many other things, but wound healing is the thing you're using it for mainly, right?
Yes, that's correct.
Okay. Now, the way in a hyperbaric chamber, the way oxygen is put in, tell me whether I'm somewhat correct there. Is basically the oxygen gets put under pressure, so one sits there. Can one sit in this thing in there? How sits? One lays in there. How does that work?
Right. Well, most of them people lie in, but we decided to get one that's the newest type model, which is one that you can actually sit in. So you can sit in it and read. You actually can fit two people in if two people want to go in together at the same time. So you can actually sit there, read. You can watch television, as opposed to most of them in which people are having to lie down and just lie there for an hour or so, meditating or relaxing. Ours allows you to sit up, and at least for me, when I tried it myself, I felt that was a better way to go. It was a lot more comfortable. It allowed me to do things while I'm in there, as opposed to just letting time pass while I'm lying there.
Right. Yeah. Absolutely. So because it's an hour long, is that what you said? You sit in there for an hour.
Yes, that's right. It's a 1 hour treatment period.
Good. So basically your body gets completely, penetrated with lots of oxygen, and so when oxygen is put under pressure, it tends to get liquid. As more pressure, as more liquid it gets. That's why the fizz in a Coca-Cola is there. And so when it is liquid, I guess the oxygen has a much better, that's what I heard, a much better way of, well, it's liquid. It now goes into the bloodstream easier because it is liquid. And let me ask you, is it true that the bloodstream basically is made out of, 80 or 90% plasma and only the rest of it is real blood? Is that kind of more or less the number?
Well, the plasma forms only a portion of the blood, and then the cells form the other portion. And so the cells are what carry the oxygen. The cells are what are going to take the oxygen to the bloodstream, to the parts of the body that we want the oxygen to go to.
And it goes in there, because it is liquefied, so it can reach the very small, very tiny parts of the body, like the brain and just, all the little pores. It can go everywhere where otherwise oxygen might have a hard time going there, which is why I guess it works for wounds so well, because oxygen otherwise cannot get there. Is that the theory behind it?
Well, yes, sort of. When a wound forms, when we treat an area, there may be reduced blood supply to that area for a little while, like if we've made an incision or treated with a laser. The blood supply may be reduced by the actual procedure, and then it has to heal. If one needs oxygen to heal and the oxygen supply is low because of the procedure that's been done on it, then it may heal more slowly. Now, if we can get a higher level of oxygen to that area, then wound healing that occurs is much greater, and as a result, the time needed to heal and the presumably possibly the outcome of the eventual healing is better as well. So
well,
the
that's
hyperbaric
wonderful.
chamber basically...
Because obviously that's what we want. We want wounds to heal better. So does that work for just... would you think it will work for, like, if people have, scars, or if they have, acne, all kinds of pimples, open acne wounds? Do you think that falls under the same category of wounds and will kind of like speed up recovery?
Well, it's not FDA approved for that use. Anything besides the actual wound healing is not an FDA approved use, and there are ongoing studies in other areas. One might suspect that it would just logically help to heal any type of abnormal tissue more easily. I know one study that's being done currently is on post-traumatic stress disorder and on post-trauma causing brain injury. And the NFL right now has a number of patients going to one study site in the United States in which the former NFL players who have dementia are being put into one of the hyperbaric chambers on a regular basis to see if the increased oxygen level that gets to the brain during that time period is helpful in healing the brain and making them function much better. And from what I've read, the early results are quite good regarding that type of treatment, although, as I say, it's not FDA approved for that use yet.
Well, anyway, I suppose a dose of oxygen on an average, I don't think will hurt. I mean, if you go to to a ski area, like just go to Vail and you will see those oxygen bars. You can get oxygen because anytime there's a decreased level of oxygen going to your body, you start having problems, and so having more oxygen must be a good thing. Absolutely wonderful. Well, I'm sure you're going to tell us more about that in some other videos, but this is interesting. Make the wounds healing faster after you have been at the doctor and he cut you and or whatever wounds you encountered. Absolutely wonderful. I think so. Anything else you need to tell us about it, Dr. Riopelle?
Well, actually, a number of athletes are using it for post-athletic process, so they will have done some type of athletic sport. For example, some of the NFL football players are using it for just feeling better and healing after the micro trauma that occurs playing pro football. There's one specific athlete who's well known for using it, who gets in the chamber every day for an hour after practice and just gives his body a nice rejuvenation to heal any micro injuries that are done with playing or running or micro trauma. So again, it's not FDA approved for this use, but he really feels that it helps him in his daily athletic career.
Great. Well, thanks a lot, Dr. Riopelle.
Okay, you're welcome, Helmut.